Welcome to Marrow Masters, sponsored by the National Bone Marrow Transplant Link, Seattle Genetics, and our esteemed link partners. The National Bone Marrow Transplant Link, established in 1992, strives to help patients, caregivers, and families cope with the psychosocial challenges of bone marrow stem cell transplant from diagnosis through survivorship. This season will focus on busting marrow myths. There are many myths related to transplant. Am I too old for a transplant? Are clinical trials exploratory and dangerous? My chronic GVHD will never end. Or will it? Does palliative care mean hospice? Is our love enough to get us through this cancer? No match in my family. Am I out of options? And timely info on CAR T cellular therapy as it relates to transplant as another option. Here's the host of Marrow Masters, the Executive Director of the National Bone Marrow Transplant Link, Peggy Burkhardt.
It's time to bust another myth. This one centered around CAR T cell therapy and who is eligible. It is my pleasure to have Dr. Ken Holland with us today. Dr. Holland is board certified in the subspecialties of oncology and hematology and the medical director of the Blood and Marrow Transplant Program at Northside Hospital and co-director of the Northside Hospital's Stem Cell Processing Laboratory. Dr. Holland is also a Northside Hospital Leukemia and Immunotherapy Program physician. From 2013 to 2019, Dr. Holland was recognized as among Atlanta's top doctors in his specialty by Castle Connolly. Well, that's pretty impressive. Welcome, Dr. Holland.
Good morning, Peggy.
So we often hear that if a patient has had an autologous or allogeneic transplant, they are not eligible for CAR T cellular therapy. Can you kindly help us bust this myth?
Well, actually, it's the reverse. The original FDA approval for the two CAR T cell products is really for patients that have failed allogeneic stem cell transplant therapy. The first was for primarily in young people and children with B-cell acute lymphoblastic leukemia. Almost the majority have had failed transplant or were just not transplant candidates. And then the second was in the B-cell non-Hodgkin lymphomas, where the vast majority of these patients had progressed after an autologous transplant. So this really is pioneering therapy that's been used for patients that either can't get a transplant or had failed transplant therapy.
Great. That definitely helps give us a better understanding. Dr. Holland, who's eligible for CAR T cellular therapy?
Well, let's first talk a little bit about what is CAR T cell therapy. CAR T cell therapy is using your own immune cells to attack a tumor, in this case, say lymphoma or leukemia. And basically what is being done is we remove patients' T cells through a very simple technique called pheresis. And in a laboratory, those cells are modified by inserting what are called DNA vectors through virus modification into these cells. It takes about 3 weeks, and millions of these cells are grown. And they essentially are then given back to the patient and will target the tumor that we're trying to kill. And they will literally go up to the leukemia or lymphoma cells, for example, attach to them and literally gobble them up and multiply thousands of times over. And usually within about 30 days, if the therapy is successful, we would expect the underlying tumor to be eradicated. So the type of patients right now that have been approved by the Food and Drug Administration to receive this therapy are two groups of patients. One are young patients or children with what's called pre-B-cell acute lymphoblastic leukemia, which is the most common leukemia in children. And then the second group are patients with recurrent or refractory diffuse large B-cell lymphomas that have failed multiple treatments, and many of them have failed transplant therapy. In addition, there are a lot of investigational trials ongoing. We're currently looking at the same type of therapy for patients with multiple myeloma. That still remains investigational. There are trials being developed for solid tumors such as ovarian cancer, acute myelogenous leukemia. Trials are currently ongoing. Hodgkin's disease, there's several centers currently doing trials. So this therapy is expanding. Now, whether or not they'll become what is known as FDA approved or not, we still don't know yet. But these are very promising treatments.
Before we discuss the products available, is there anything else you want to add?
Well, I think in terms of patients who are eligible for the therapy, this has been a major breakthrough for the children and young adults with pre-B-cell acute lymphoblastic leukemia. So many of these patients are incurable without this therapy now. They either have failed transplant therapy or for various reasons, they just could never get a transplant because they had too much leukemia. And so those are the patients that are deemed to be eligible candidates for this therapy. Essentially, CAR T stands for chimeric antigen receptor T cell, and that's a fancy word that means that the T cell, which is a natural white blood cell that we all have, its job is to go out basically on a search and destroy mission. But it can only do that if it can actually see the bad guy it's trying to find. And most leukemias and lymphomas have the ability to mask themselves so the T cell can't see them very well. And what CAR T cells are, the T cells have been modified by removing them, placing them into a laboratory setting where the cells are called incubated with virus vectors that change the T cells to actually put on the surface of the T cell a chimeric antigen receptor that can see and identify the leukemic cell. So it wouldn't be any different than you're in a submarine, now you got a periscope and you can pop it up and look around and see the targets you're trying to attack. Then on top of that, these cells are triggered such that when they do come into contact with the leukemic cell, for example, it will activate the T cell to actually turn on and kill the leukemic cell. And in addition, multiply and make more of itself. It's cloning itself to making hundreds, if not thousands of copies. And it's a very aggressive, very robust attack against the leukemic cells. So within weeks, all the leukemia cells hopefully are destroyed using your own immune system. This is very different than what we do in transplant therapy, where you're giving very intense chemotherapy, and then you infuse donor cells, which will do the same thing, but they're slower in how they do it. This works very quickly in terms of its effect. However, this therapy is not a benign therapy. It has to be done only at special centers. It has a significant amount of side effects that are similar, though different than what we'll see in transplant therapy. Patients have to be treated at a specialized center.
Are the side effects really difficult? Can you talk about them?
Well, when you infuse immune cells that have been set up to multiply and to trigger when they attack the leukemic cells, they can release what are called cytokines. So that's not much different than if we get the flu, for example. We get high fevers, we ache, we don't feel well. The same happens when you infuse CAR T cells to attack leukemia. They'll release these cytokines and patients can get high fevers, but it can be much more pronounced and they can become quite ill from this within a few days of the infusion. They can get what are called neurologic side effects. They become confused. They can have issues with their blood pressure. They may have difficulty getting enough oxygen into their lungs because their respiratory system gets compromised. So frequently, these patients have to be placed in an intensive care unit for a period of a few weeks to support them to get through it. But in general, the patients will recover, and usually within a few weeks, they're becoming back to normal and can get out of the hospital.
Thank you for that. I know that we are seeing and hearing from patients that are now in remission because of CAR T. It sounds like it's going to be a real game changer, and it's going to help a lot of people that are possibly running out of options. I understand there are 2 commercially available CAR T cell products. Can you elaborate on these? And also, what's on the horizon?
Yes. The first product that was approved was produced by a company called Novartis, and that was done in collaboration with our colleagues at University of Pennsylvania. And they got approval initially for acute lymphoblastic leukemia, which is the pre-B cell ALL for children and young adults. And then they subsequently got that same product approved for diffuse large B-cell lymphomas that have refractory or have multiple recurrences after initial treatment. The second product that was approved is called Yscarda, and that was developed by a company called Kite. And it's a very similar, although somewhat different product than the Novartis approved product. And that one targets diffuse large B-cell lymphoma. They are doing trials similarly in acute lymphoblastic leukemia, but the Yscarda product is right now only approved for lymphoma patients.
Are there any CAR T clinical trials available?
Yes, there are dozens and dozens of CAR T trials ongoing. And the reason for this is that the first 2 approved products have been so successful in their initial trials that there's a tremendous amount of excitement across the medical community in investigating this same technology for other types of illnesses. So For example, there's a large phase 3 clinical trial being done right now in multiple myeloma, which we're participating in. And we're hopeful that this will also become approved in the upcoming year. There are trials ongoing in acute myeloid leukemia. There are trials ongoing in Hodgkin's lymphoma, which is a different type of lymphoma than the B-cell lymphomas. There are talks about starting trials in ovarian cancer and other solid tumors. So there's a tremendous amount of activity ongoing, and there are probably several dozen, if not more than that, trials currently ongoing.
Dr. Holland, can a patient receive CAR T-cell therapy with their referring hematology oncologist?
The process of getting referred to a program for CAR T-cell therapy first requires you to be referred to a special center in the United States. There are only about 40 centers in the U.S. that are approved to give CAR T-cell therapy. And the regular hematologist, oncologist in the community is not certified or capable of providing that therapy at their own site because of the significant amount of resources required to administer it, as well as the serious side effects that can occur from it.
And obviously, your center is one of them. How long have you been doing this with the CAR T?
We've been doing immunotherapy now for 3 to 5 years. And in terms of the CAR T trials, we participated with some of the original studies that were done and obviously ongoing with clinical trials currently.
And how expensive is CAR T-cell therapy?
Well, it's an important discussion to have. CAR T-cell therapy for the 2 products that are approved by the FDA are very expensive. They're as expensive, if not more so, than even allogeneic bone marrow transplant therapy. And there are really 2 parts to the cost. The main cost is the actual CAR T product. It has to be produced in a laboratory, either through Novartis or by Kite. And it's a very expensive, very labor-intensive, and it costs about $400,000 just to produce the product. In addition to that is the cost of actually taking care of the patient, to collecting the cells, administering them, giving what's called a preparative regimen, and all the post-care that's required. Patients are in the hospital frequently for weeks, and there's several months of very close follow-up required. So the total cost can approach $1 million per patient. Currently, most of the third-party insurance companies, such as Blue Cross, for example, will cover the cost for CAR T-cell therapy, assuming the patient's qualified to receive that therapy. Unfortunately, right now, Medicare is not willing to cover the costs for the treatment. They'll cover part of the costs, but we're not aware of very many centers in the United States right now that are able to do Medicare patients because of the exorbitant costs involved. And similarly, the same issues there for Medicaid patients. So we in our society have been actively lobbying Congress and the Medicare groups to provide appropriate coverage for this life-saving therapy for patients.
Dr. Holland, I'm sure you get to meet so many people and now patients that are in remission because of CAR T. Would you be willing to share a story, perhaps one of your patients in their journey and how they're doing now? I think it would give great hope to people listening to know a story or two.
Certainly. We have many of these basically miracles that we work with. One that comes to mind recently is a 19-year-old young man who lives here in the Atlanta area, very intelligent. And he unfortunately got pre-B-cell acute lymphoblastic leukemia. And he had this type of leukemia that we knew was unlikely to respond to conventional therapy. And our goal was to get him onto a allogeneic donor transplant. He had a sibling donor available for him. But unfortunately, he did not respond to multiple efforts to get his leukemia under control. His leukemia was essentially refractory to all the conventional therapies that we could provide him. Because of that, he qualified for the CAR T-cell therapy. And this is exactly the type of patient that this therapy was initially designed for. And he has gone forward and been collected. His CAR T-cells were produced and they were infused. He tolerated the treatment relatively well, had a few side effects, but actually did remarkably well. Is back out. He's currently at home, functioning reasonably well. And the follow-up tests so far show he's in a complete remission. We hope that this will continue to be the case.
That's so inspiring. Thank you for sharing that. Anything else you'd like to share at this point?
I think it's important to understand that there are hundreds, if not thousands, of very dedicated people in the healthcare community trying to improve the outcomes for people with hematologic malignancies such as leukemia, lymphomas. And the CAR T-cell story is one that goes back over 20 years in its development. It's finally come to the clinical forefront. And I think we can expect many more of these advances over the next decade as we get to understand these CAR T-cell treatments, how to make them better and more effective.
Well, thank you so much. We definitely busted another myth, and I think this is going to help so many people to better understand CAR T and offer so much hope. Thank you so much, Dr. Holland, for being with us today.
Thank you, Peggy, for letting us speak with you.
This has been the Marrow Masters Podcast. Feel free to share this episode via social media, text, or email. To hear more, subscribe for free to Marrow Masters in your favorite podcast app. To learn more about the resources available to patients and caregivers, check out the National Bone Marrow Transplant link at nbmtlink.org. That's nbmtlink.org, or just tap the link below in the show notes.